Hello, everyone. Welcome to the All-Mercy podcast. Once more, we are talking about staffing issues, staff abuse in healthcare facilities, and how those can impact our mental health. What is health without mental health? When we go into these facilities, the goal is to take good care of the patients, meaning we are not just taking care of them physically. We want to make sure they are happy. We want to make sure they are feeling good. We want to make sure they are comfortable. We want to make sure they appreciate the care that we give. And we cannot do all this without taking care of their emotional health. However, sometimes it turns out that challenges stop us from giving that kind of care that we need to give. And not only that, we in turn become the victims of what we are doing. Staff can abuse us, the companies can abuse us, our leaders can abuse us. It's so possible. And all this will affect our mental health. How do we give that kind of care when we are not mentally stable? And if we are not mentally stable, of course, we are not physically stable as well. How do we give our all or our 100% when we are not getting or receiving any support, when the challenges are crumbling and trashing us every day? It's okay that one day we try to cross a staffing milestone, but if it's every day, if it is continuous, if it is persistent, this can greatly impact the kind of care that we give and the kind of quality care that we expect our patients to receive. I have with me here someone who is returning. I, I think what we are doing is not just a podcast at this time, Mr. Kenny. No, he told me not to call him Mr. He said, call me Welch. So, what we're doing at this time is not just a podcast, and what we are doing on the ground as well is to try to create that movement where it will take us from podcast to Senate to somewhere, because we are not just creating awareness, we are wanting to bring a change so that in our workplaces, especially as nurses or caregivers or healthcare providers, we are being treated fair, not just in theory, but in practice as well. So, Kenny, please introduce yourself and welcome back to this. Welcome back. Please introduce yourself to our audience.
Thanks again for having me. I'm Kenny Welch. I'm the current administrator at Cimarron Park Nursing and Rehab in El Paso, Texas.
Thank you for coming. And I heard your staff voting you as the best administrator ever. So when
We'll,
I see
we'll
that,
see.
I'm like,
I think it depends on what day you ask them, but some days maybe.
I think most days that's what they are saying. And for staff to say we have the best administrator is not something that they say all the time. Brittany, welcome. Please introduce yourself.
I'm Brittany Carter. I am the Staff Development Coordinator, Nurse Manager at Cimarron Park. Thank you for having me.
Thank you for being here, nurse manager. When I hear nurse manager, I laugh because nurse managers, I don't know if they sleep. They should sleep. I don't know if they do. Most of the time, they are expected to answer their phones 24/7. They are expected to make miracles happen, whether they are on vacation, whether they are at work, whether they are at home. And they are expected to be there at all times. It is not easy. Been there, done it. Kudos to you. Will never want to do it again. Miss Gloria, I am just so happy to meet you today. Finally.
Thank you for having me. I'm very happy to meet you as well. Hopefully, I get to meet you in person sometime.
I hope so. I think you're coming at my book signing October 5th.
I see that, and I'm hoping to be there.
Yes, and I will see you. I will be so grateful. So please introduce yourself, Miss Gloria.
Hey, my name is Celia Gloria, and I am a restorative CNA for Birchwood of Richland Hills. I've been a CNA for 29 years.
Ooh,
Yes, thank you.
wow. Wow, wow, wow. 29 years. I want to tell you something, Miss Gloria. In healthcare facilities, your role is super crucial, super, super crucial for things to go well. My very first job as a nurse, if it was not for my CNAs, I would not have made it. I learned so much from them. So much. If it was, and I'm just talking about now, I'm thinking about the environment, I'm thinking about all of them. They quickly, it took them just less than a minute to realize that I was a new nurse, and they're like, huh. And they're like, are you that kind of a nurse who doesn't help out the CNN? I'm like, if you show me what to do, I will do it. And that's how we rode. I learned a lot from them. So welcome and thank you for all you do. Thank you so much. Thank you so
Thank you.
much for all you do. Mr. Kenny, we've been talking about this for a while. Have you realized some other new strategies that have been implemented to address nursing shortages, and have they been effective?
It goes back to the environment that you want people to want to come to work in. I can't unfortunately fix the fact that they're extremely underpaid for the work that they do. I mean, they're eyes and ears of the residents, and yet they're one of the lowest paid professions. And we were just talking about this the other day at work that you can go to McDonald's and make more money and not have a third of the stress that you have taking care of loved ones. So obviously, we need to make that happen, but we need to empower them more, and get their inputs on what makes the facility better. Because honestly, they're doing all the work. They're the ones that are taking care of the residents on a daily basis. So why wouldn't we utilize their expertise to improve how we do things?
Especially when we realize that they could get the same or more pay somewhere else, not even related to healthcare, but
Right.
they choose healthcare, yet not getting the compensation that they deserve. So it is still a challenge, and it just means that we have to work harder, more and more and more, to make sure that they are being appreciated. And going back to Mr. Kenny, do you think that, I'll try to call you Kenny, do you think that the pay is the biggest challenge though?
Yes and no. I think definitely they should be compensated, but I think they need to be appreciated. I
Mm-hmm.
think that goes a lot further than compensation. I mean, they should be able to make enough money to be able to take care of their families. But I think respect and appreciation go a lot further,
Mm-hmm.
and creating an environment that they want to come to work in makes a huge difference. Uh, you know, um, we've talked about this in several podcasts. If we're working them 16 hours a day, how do we expect them to come to work and be well rested and ready to take care of our residents?
Mm-hmm.
So I think appreciation, and I'm not talking about here's some pizza for doing a good job.
We don't
I'm
want
talking about
we don't want pizzas anymore.
nobody wants pizza anymore. So I'm talking about genuine appreciation. I mean, it means the world to go out on the floor and tell them thank you for what they're doing.
Mhm.
Um,
I
I
agree.
recently I recently posted a sign in the building that says, "Hey, listen, we think a lot of our staff. So if you're coming in here with negative comments, please don't. And if you think you could do it better, we're taking applications." So I just think appreciation and make sure that we take care of them, and that it's not always ever we focus so much on what they don't do right.
Mm-hmm.
There's so much more they do right than they do wrong. So let's not focus on that so much. I mean, just because a family complains doesn't mean the family's right. There's always the other side of the story, and many times we get family complaints. I said, well, let's talk to the staff first to find out what happened, because a lot of times it's not how the family, said it happened. So I really think appreciation and respect go a lot further than compensation.
Yeah, a lot of time the families are just telling their own perspective from a subjective point of view. Doesn't necessarily mean that that is what happened, and then we immediately jump
Right.
in conclusion to abuse the closest person to that staff, which is most of the time the nursing assistants.
Right.
Ooh, ooh. Coming to you, Brittany, what are some of the common forms of staff abuse in nursing facilities, and how preventative are they?
I think the most commons that I've seen is just the verbal, physical, sexual harassment, racial discrimination. You see all of that.
Mm-hmm.
So, and I think that of course, education can go a long way to help prevent it,
Mm-hmm.
but um, you know, not accepting it as a normal thing helps prevent it from happening.
Do
So,
you think the abuse can be related to staff shortages?
I think it can be. If you have family members or residents who are upset because they're not getting the kind of care they want as quickly as they need it or want it, they're going to take it out on you and they're not going to be nice about it.
Yeah.
So, definitely the shortages make it hard.
Yeah. And I think we've talked in one of our podcasts where the abuse is not just coming from staff or from it's coming from residents as well. And it generated from staff shortages where the resident is angry that they were served cold food and it was just one staff during that shift passing out the trays. And could that have been prevented? Maybe, maybe not, depending on the census and what was going on in the facilities that day. But a lot of time, it could be prevented if staff is there, present, or if they are getting this support from you are a nurse manager, from the nurse managers, from their supervisors, and everything. Do you have a case where you think that it could have been prevented here, yet it happened?
I I think yes. I think sometimes whenever we all get busy, we all have deadlines, we all have things that we need to get done and we forget that, patient care always comes first.
Mm-hmm.
Of course, we're all there to do our job and do our best that we can, but we forget that patient care is the whole reason why we're there. We're there for them. And
Right.
so sometimes that does play a factor or that plays a role in it. And it can always be prevented.
The unfortunate thing too with nurse managers that I see is that they quickly call you guys, go support your staff, or you guys quickly jump to support your staff and renegade all your other duties to the background. And before you know, you've been on the floor all day for 8 hours. Then you tend to carry your own work at home, or it falls behind. It is still on you. You will not be able to give an excuse that, oh, I was working the floor. Oh, I was helping my nurses. Oh, it's not even helping. You were doing the job. So have you had that stress a lot?
I've had it sometimes when things do get hectic, especially with the shortage of staff.
Mm-hmm.
So, you want to make sure you take care of your residents because they, like I said, they're the reason why you're there. But also at the end of the day, you gotta do your job. You gotta make sure everybody is able to get paid. You gotta make sure the building's making their money that they need to make. So we all have the job.
The building is making their money. Mr. Kenya, I'll come to you for that very soon. The building is making their money. Is that why we are in healthcare? Let me go to Miss Gloria first. You just said something, Brittany. We are making sure the building is making their money. We'll
Uh,
talk about that later. Yeah, Miss Gloria, you have the most important role in healthcare facility. The most important, the crucial role. The role that is, I'm not sure how to put it, very, very much needed. But I feel like sometimes it is very, very much less appreciated. How has this shortage in nursing affected your role, Miss Gloria, and daily responsibilities as a restorative CNA?
It's affected it in having an increase in workload, more stress, more burnout, uh, less quality care for our residents.
Absolutely.
I mean, that's number one there. Um, yeah, less productivity. I mean,
Mhm.
and when there's more work for me to have to get done, and when I can't get it all done, I feel bad. I feel bad in myself.
Mhm.
I beat myself up about it. In other words,
And you've been doing this for 29.
29 years now. Now, give or take, in between those years, I have done other things, but taking care of working in the healthcare field and working with the elderly, I love that job. So I always come back to it.
There is no way you will do it for 29 years if you do not love it. We are missing one person today in this podcast, some emergency. But Miss Gloria, there you are. You have your nurse manager, you have your administrator. Hypothetically, they are yours, even though you guys work together. What would you like to tell your nurse manager? What would you like to tell your administrator about your role? Not like they don't know.
Oh, can we get more teamwork? I mean, can management step out and kind of help with the less, like the passing ice water, answering a call light, yeah, things like that.
Mhm. Are you guys listening? Can we get more teamwork? Do you push for teamwork, Mr. Kenny? Kenny? Do you push for teamwork at your facility?
Oh,
Is
of course,
all you for teamwork?
everybody can answer call lights. I mean, that's the number one rule. Housekeeping, every department can answer call lights. It may be just, can I have a glass of water? It doesn't always have to be a nurse that needs to answer the call light or a CNA. So everybody answers call lights. And do I say it's absolutely perfect? Of course not. But we're working to make it better. I mean, and that's a big help, I think, to the CNAs is just answer call lights. Um, like you
Oh,
said, pass refill water. If you go in the room and every day the managers have to do room rounds. And one of the things in the room rounds is, are their water pitchers filled up? So if they're not, go fill it up. Don't go find a CNA to do that stuff. That's one of the things that will excite me more than I want is when somebody says, well, let me go find a CNA to do that. No, you can go do that. So yeah, we definitely promote teamwork. And again, is it perfect? No, but are we working towards a better place? Absolutely.
Beautiful. Beautiful. What about you, Brittany? What do you think about teamwork as a nurse manager?
It's a necessity. It's a bit teamwork can change the whole dynamic of everything. Everything from the morale to,
Mm,
knowing that you have somebody there to lean on when you need help, not
yeah,
being afraid to ask for help, and someone being willing to do it. It plays a big part on how your day goes. So teamwork is, like I said, a necessity.
and like you say, it can change the dynamics of the care once everybody feel supported. It
Yeah.
feels everyone feels inclusive. Like it is our patient, it is our job. Let's do this together. It doesn't make the CNA feel like, oh, it's my job to do this, while the manager feel like it's my job to be in this office and do the paperwork. And once they feel like they are getting the support, this is from my own experience, when they feel like they are getting the support, you don't even have to be there for them to give it their best. When they feel supported, sometimes you don't have to be there for them to do their best or to give their best. Coming back to, is the facility making money, Kenny? Do you think that is driving our facilities today more than the care that we are giving?
Of course it is. I mean, it's the reason everybody's in business. However, I think if you do these things that we're talking about, if you support the staff, if you create an environment that people want to work in, and you take care of your employees, you're going to make money. You don't have to make that the priority. It's going to happen because you're doing all the right things. Everything just kind of falls into place, and of course you're going to make money. The care is going to be better, and people are going to want to come stay there. So then you're suddenly, if you create an environment, then money's not the motivator to make all that happen.
Wow. Yeah. Do you think that educational institutions and government policies have started to address the nursing shortage?
Not really, honestly. But the CMS wants to implement mandatory staffing. So you're going to punish facilities for not having adequate staffing when they can't find staffing now. So I'm not sure how that's going to fix the problem. I think, I think what needs to happen, honestly, is people that work in this industry need to be invited to speak at educational institutions and talk about these issues and what's going to make these facilities better, from the experienced people that have done it. Yeah, I remember being brand new. I thought I knew everything, and I didn't know anything.
Oh,
You know, so if somebody would have came in and said, "Listen, I've been a nurse in the nursing home industry for 15 years," probably would have taught me some things I didn't have to learn the hard way. So I think that we need to get people that have been in this industry a long time into these educational institutions and have some real world experiences they can talk about to those students.
I also heard about dating staff, and that just cringes me. I'll ask this question to you, Miss Gloria. What would you do? You have a child at daycare, you have another one in school, which should be coming out, and he doesn't have the key. You have to leave work at a certain time to pick up your child and daycare and be home for the one who is coming back from school to have access into the house. Then Miss Brittany comes and tell you, hey, your 3 to 11 or your 6 to 10 relief coding, you're mandated to stay. What would you do?
Well, that's
Not even what would you do, how would you feel?
I would feel not appreciated. I would feel like uh, my job. She's putting me in a position, or they're putting me in a position where they're making me choose my child over my job.
Yes.
Oh, what am I going to choose? I'm going to choose my child.
Mm-hmm. Yeah, yeah, I will. Okay, it gets better, Gloria. They said if you leave without a relief, they'll report you to the Board of Nursing for job abandonment.
Well, that's even tougher there.
This is a 29-year career. They said they'll report you to Board of Nursing for abandoning your job if you leave. Then daycare is calling you. They're about to close. Come pick up your child. Then the other one from school, the bus drops them off and they are stranded at the door. They can't get in. Your job is telling you, if you leave, we call the Board of Nursing for job abandonment. Why should we even be put in that space?
That's a good question there. I don't know what to say about that. I mean, still, I'm going to choose going to get my child. Uh, I mean,
I will go get my child.
yes, yes. But I'd still feel like I wasn't, I wasn't supported enough in my job to at least let me go tend to that issue, and then possibly come back to finish my shift. I don't know. That's a tough one there.
It is tough. It is tough because we have compliance to meet. Patients need to be taken care of. There's nobody. What do we do? Have you had cases like that, Brittany?
Yeah, in previous jobs, I've been in that position many times. And it's gotten to the point where I just, I had to find a different job because, that support having from your upper management is a big deal. Knowing that, we're all humans and we have life that goes, life's outside of work. And they have to keep in mind that they've all had things happen too where they've had to leave. And at the end of the day, we're all there to support ourselves and our families. And, I personally, I'd rather just leave and find somewhere where I can be that, that supports that.
Yeah, especially if it keeps happening. And Gloria, let me come back to this. If I am mandated to stay, I hope somebody is not mandating me to stay, then that person leave and go attend to their own duties at home. Yeah. I hope a manager is not telling me, oh, you must stay, then leaves and go home. I hope. Do you get to see that a lot, Kenny?
Um, we do. I had an employee the other day covering for another manager, and she said she had a family emergency, and I said, "Go, we'll see you." And she said, "What about the residents?" I'm like, "We'll take care of them. You go take care of who you need to take care of." And that's if they're not going to be productive,
Mm-hmm.
if there's problems at home,
Mm-hmm.
and they can't go address those issues. And almost all of my employees have kids in various ages and various things that go on, and kids get sick. Kids sit home from school. They have half days. Um, they bring their kids to work sometimes. It is what it is.
Mm-hmm.
And 99% of the time, I don't even know the kids are there. They keep them in a place occupied. So and surely we can cover for a few hours while they go take care of these issues. Otherwise, they're not they're not gonna they're gonna want to be at work. And how sad to think that. And I know Brittany has kids, to think that she can't go take care of her kids. What kind of environment are we creating when we don't allow people to take care of their families? Your family should be more important in this job. I mean,
Having
so
a good team makes it work though.
it does.
Yeah. Knowing that knowing that the upper management really care, and that you came to work at 7 a.m., you saw them there, you're leaving at 9 p.m., you still see them there. It just fuels another moral support that you need. You know that, okay, it's not anyone's fault, it is the climate in nursing right now, but I have all the support, and all hands on decks makes it easier as well. It's not the ideal environment, but we can make it ideal for some situations, knowing that we have that mentality that we are in this together. It may take the edge off, it may take the stress out, it may take the frustration out, knowing that, well, I've been here for 8 hours. So has my manager, so has their managers too. It doesn't solve the problem though, but it gives us that comfort that we are in this together. Coming to you, Brittany, how does the stress of working in an understaffed environment contribute to incidents of staff abuse? I think we
Yeah,
have answered that already.
I think I think whenever you're understaffed, you obviously can't give the best care. You just can't. When you have more patients than you have nurses and CNAs, you're not able to, document the things that, need to be documented that make a difference with care. You can't call families with every, all the updates, That's not just for the bad updates, it's also the good updates to say, "Hey, your loved one sat up today all on their own." Those little celebrations. You can't do that.
Yeah.
And when you're burnt out from being understaffed, you don't care as much. You don't give as, can't give the best care. Creates low morale.
Yeah.
Nobody wants to be there because they love their job. And
As much as we may love the job or love what we do, we need to still take care of our families. So, mm,
So it all gives, little entries for staff abuse to happen,
mhm,
whether it's from the families, the residents. It's all from, being angry for the understaffing issue.
mhm.
So it contributes a lot.
Especially family comes and takes it on the staff, even when they understand that they are understaffed. But at that moment, it is me, my family member, whatever is going on. I don't care what systems you guys don't have in place. It is me, 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 and they take it on the staff. And I have worked in a place where family even one staff and say, each time you work, blah blah blah. My mom does not get repositioned every 2 hours as she should. I'll meet you outside, and tried and stepped out of the facility and waited until to see what car that staff will come out and drive, and took the license number. And good thing the staff realized what was going on and stayed at work and called for support, called the police, like, I am being stalked by a family member. This should not happen. The staff should not be blamed for the shortage. I feel like it is high time something drastic really needs to be done so that we are heard. Something more than sitting here and talking about this need to be done so that we can change the way all this impacting nursing. Do you think, Mr. Kenny, do you think that there are some legal and ethical responsibilities of healthcare administrators preventing and addressing the staff abuse? Do you think that as an administrator, I know you understand it is your responsibilities, but are there some legal implications?
Oh, I think so. It's our building. It's our responsibility. Everything that goes on there is our responsibility. And so I think that assisting with, let me help you find staff. Let me make some phone calls. Let me call some people. Let me help get people in here so
Mhm.
we're not short staffed. I mean, everybody knows somebody in healthcare.
Yeah,
So we usually have friends we've worked with, but I think that, um, you know, the awareness, we have to create the awareness so people understand this is going on. And I think that, and one of my research questions I think I'm probably going to ask for my dissertation is, does violence towards healthcare workers impact staffing, or does shortage of staff impact, either way, violence amongst healthcare workers? And I think we're going to find that, when I'm finished with this study, that they're both directly related to one another, and it's a never ending cycle. That if we don't do something, it's never going to end. And it's more than just like you said, being on a podcast and talking about it. We need to make everybody aware of it as much as possible.
yeah. And in your dissertation, Kenny, this is one dissertation that I would love to read. And I hope that when you're talking about violence, you're not just talking about physical violence, emotional violence as well. That
Oh,
would.
and I think the staff take the worst emotional violence from
Mm-hmm,
family members. We've not even talked about family members,
mm-mm,
especially toxic family members, that no matter what happens, they treat the staff like they don't matter.
mm-mm,
And when you're talking about physical abuse towards the staff or emotional abuse, what resources are we providing
mm-hmm,
to help with that? And I tell you right now, it's none.
mm-hmm.
So,
And sometimes I've seen cases where it became personal, like family having a conflict, took it to a personal level with the staff, but the staff had no support from upper management. Then this patient, it was just continuing. They'll call the state, they'll do this. And that patient happened to go out. Guess what? After like a week or two, they are still requesting to come back to that facility, and the administrator is saying, oh, we have low census, I cannot refuse. Number one, why do you even want to come back to that facility that you claim treated you so poorly in every way? Why are you coming back? And the administrator, knowing what staff has gone through above and beyond not being able to make this patient happy, why are you still taking that patient, considering the amount of abuse that they have bestowed on your staff? So it's still just about making the census, which is sad.
We have this conversation at work all the time, and I'm telling you right now, and we've talked about this. If I felt my mom was treated badly, or my father, or whoever, I'm not staying.
Mm-hmm.
I'm not going to. If I really think this place is that bad, I'm going to move them.
Mm-hmm.
But they don't.
They don't. Patient get ill, go to the hospital, stay in the hospital for a week or two, have other facilities they can go, but they choose to come back where they feel like they have power and where they feel like they have control, and also where they feel like they have been allowed to do what they want to do. That's why they are really coming back. It's not because they were treated bad or good. It's because they know that they have control over the staff. That's why they are really coming back. And it is sad that we are allowing those things in our facilities. Or another one is not even the census. Another one, we are thinking that if we deny this patient, will not be giving patients anymore, or they may report us for denial and we have no backup. It's a shame. It is a shame how healthcare is growing every day. It is expanding every day. Innovation, all category, it is expanding. But I don't feel like the expansion is benefiting the staff in a good way. The shortage stays, the neglect stays, and the bad compensation or the not so great compensation stays. This is something we have to address and address like yesterday. So we are doing some background work to see how we can write to state, we can get other people involved. So this is not just a podcast. If you're just joining us, this is a movement where we are fighting that yes, we may not change the nursing shortage or the staff shortages in healthcare facilities, but we may change the way that the staff is being appreciated or the way that they are being compensated. We need to change that narrative. The dynamics of how staff gets burdened, burnt out, overworked with very little pay needs to be addressed and addressed soon enough. Because when everyone walked out of healthcare facilities and we have sick patients, what do we do with them? How do we care for them? And I want to ask you this, Ms. Gloria. How do you manage increased workload and stress from staffing shortages? I know you've been there. There's no way being in this thing for 29 years, you have escaped this. How do you do that?
Uh, how do I manage it? Well, uh, one's breathing techniques. I have to learn to breathe. um, self care. You know, self care is a big thing. You got to take care of yourself uh, before you take care of residents, and that's a big thing.
Mm-hmm.
Physically and mentally, actually.
Mm-hmm. Because you cannot pour from an empty cup.
No, no.
You cannot pour from, if you don't take care of yourself, you cannot pour from an empty cup. Do you feel like, do you feel like you have your management support where you work right now? We're not throwing anybody under the bus.
Yes, where I'm at right now, yes, I
Mm,
do. There's
that's good. That's good. Do you feel, have you ever like witnessed or experienced staff abuse at your job?
yes, as a matter of fact, I was part of that. I had worked, and keep in mind the ADON at the time is no longer there.
Mm-hmm.
But I was placed in the memory care unit working with 18 residents to myself. Several of them,
How many? 18?
18, to only me. And that created a lot of stress. But I had a resident that was going after another resident. So I got in the middle of it. I had to get myself in between both of them. One of those residents reached over and bit me, and I wasn't fast enough to get away. Okay, well, the only thing I could do, because like I said, it's a locked unit, I was back there by myself, was grab my phone from my pocket and call the front office. Hey, get somebody back here.
Mm-hmm.
Help. Yeah. And that in itself made me just want to quit.
Yeah.
Yeah, because the ADON at the time did come back there, and he told me that that's what I signed up for.
Ooh.
And him saying that right there is what made me not want to come back. But unfortunately, I'm still there.
And I'm sure what he said was even more hurtful than what the patient did.
It was once again, I felt very unappreciated. So
I have had cases where that happened, and the first thing the nurse manager came and said, "What did you do?" Asking the staff, not even evaluating the safety of the place, not even making sure that the staff is safe, but immediately assume, "What did you do?"
well, I wasn't asked that because they already knew. They already knew.
Because even working with 18 patients alone, and those 18 patients is not like, I know there are some who are bedridden, some who needs maximum 100 support, physical support, and all that. Brittany, how will your staff go through 18 patients gracefully, smiling, singing, good demeanor, and give quality care, all that they can put on the table, and work with 18 patients, and got injured, and you came, this is not you, and you came and said, that's what you signed up for.
It's not possible. I don't see how anybody could go through any of that and then expect, you to go back to work and be chirpy about it. Your feelings count. You have to feel appreciated, and you have to know that you have to be acknowledged that you did your best
Mm-hmm.
with what you were given. An impossible task at that. 18 patients.
Mm-hmm.
That's hard. I don't see how anybody could go back to doing their job and giving the best care, knowing that you just got told, "Hey, you did your job, but it wasn't good enough," even though.
Yeah, yeah. And if Miss Gloria had left that day and said, I'm not coming back, guess what? She did not leave her job. She left the people that she worked with. Because she may still live loving what she did or loving what she do all the time. She may go get another job at another facility doing the same role, but she left that person who made her feel so unappreciated. So she did not leave her job, but she left the person she was working with. Kenny, how would you handle this?
But my head almost exploded when she said that's what you signed up for. I want somebody to show me a nursing school where it says, here's the part where you're going to get beat up and you're just expected to take it, because nobody in this industry signs up to get abused, whether it's physically or mentally. But this is the awareness that we have to make. people understand. And then we have to get resources in that would have helped her and say, listen, are you okay?
Mm-hmm.
Do you need to talk to somebody? We're going to send you home today. And let us know a day or two if you're ready to come back. Not, that's what you signed up. Nobody signed up for that. And that's,
Signs up for that.
and so this is a mentality we have to change.
Mm-hmm.
Everything else aside, but again, nobody gets up in the morning and says, man, I hope this is the day I get beat up and go to the hospital. So it's not what they signed up for. It's not what they should expect. They expected to go in and provide care, or they wouldn't be doing it as long as Brittani has, and as long as Gloria has. They wouldn't be doing it this long. And it's not about the money. It's about their love for what they do. And that's what we need to focus on and make it an environment that they can feel like that's where they're working in. And enough with this is what you signed up for nonsense, or this is what you get paid for, because it's not. They get paid to take care of residents in a positive, comfortable environment that's supported by everybody there.
Yes. And Miss Gloria, I know that's just one of many cases. I have a case also that I have been abused in a facility. I shared that many times. And it hurts. That is not what anyone signed up for. And for another nurse, not only a nurse manager, to say that is what you signed up for, you should have asked them, like, show me when I was hired. Where is it that said I signed up for getting beaten and should not even ask for support or should not even complain? Where is it that I signed up for? Because I bet you if you signed up for that, that's what they signed up for as well. And this attitude, Kenny, that we expect that is what you signed up for, it leads me to this question for you. Have you noticed staff abuse? How does that impact overall morale and retention of the nursing staff? As the father of the building, with this attitude or with this morale, how does that affect staff retention?
Who's going to want to come to work at a place they're going to get beat up? Nobody. And you talk about what's not about the money. There's enough money you could pay somebody that goes to an environment every day where they get beat up and then not supported. So it significantly impacts that. And I think through my dissertation, I'm going to show that it's the vicious cycle that I just talked about that's never going to end if we don't fix it. And it's not like you said, doing podcasts, but it's making people aware, getting laws changed. And it's interesting. I'm doing annotated bibliography now in one of my classes. And there's a study I'm reading right now, one of my first ones, where there's laws against this stuff that they compared to in a state where there's laws that there aren't laws for this type of abuse in facilities. And the difference is amazing, where it's illegal for you to attack a staff member in a nursing home. And you get serious consequences. And we're talking about people that are aware of what they're doing. We're not talking about dementia patients. We're talking about people that are well aware of what they're doing. And when somebody faces jail time for sexual assault or physical assault, it's different. And so I don't want to sound insensitive, but they don't get a free pass because they're in a nursing home to do whatever they want to do.
It feels like they do most of the time.
It does, and we've got to stop allowing that to happen. And that's where we need to get, whoever we need to get involved to change the laws that say, you know what, our nursing home staff shouldn't have to put up with this. If we really want to improve staffing in this industry, it's got to start with support of the staff from everybody, from management, from Congress, from the state, from everybody.
We are just as a physical being with a heart full of love to give care for the patients, with a strength full of abilities to give care for the patients, with a body and soul connected to what we are doing. There is no way you find people like Miss Gloria who have been doing this for 29 years and say they are doing it for the money. No. There are so many other things they could do for the money and for more money. and for more money and for some appreciation than getting abused or having a terrible day at work and for her manager to say, you signed up for that. Nobody signs up for this. This is if this is what we are signing up for, we signed up for other jobs. Without this, that doesn't have this related to it. Again, thank you all for watching. We appreciate you. We'll read your comments soon. We are mindful of that. We just have some things to take care of. Where do we start, Kenny? Where do we start? Being where we are in our various states, I think that we should find somewhere, start writing some letters, start inviting some people to our facilities, start going to meet them and say, hey, maybe you guys sit here and read about theory, give our nurses a 6 to 8 hour window to give medications to 50 patients, 2 hours, not feasible. Maybe you guys sit and think that with staffing shortages, a, a CNA can give care and again turn and repositioning every 2 hours to 18 patients in 2 hours, not feasible. Can you guys just come into our facilities and see what we are doing and see how we can revise some laws? And not just that, and see how mandating staff to stay is not the solution. What do you think, Kenny?
I think you got to get them in the building. Have them follow the CNAs. Have them 4 hours. That's all I ask. Come in and
Not
follow
sit
the CNA.
in your
Not
office.
even a full shift. 4 hours.
Let them come in, not sit in your office, because most of the time,
No, it's not about me. It's about them. Come, follow them around for 4 hours and see what they do, and then tell me how they're going to get all these tasks done. All these incredible regulations that you've set forth, like you just talked about,
Mhm.
deliver medications to 30 residents in 2 hours. Come watch that. Come see that. Come tell me
Mhm.
how they're going to get that done, how they're in trying to provide care for somebody that's beating them up for trying to provide care, yet you still want them to get the care done. That's what I want to bring as many people that change the laws into the nursing homes to just watch. So again, I don't want it to be a photo op where you and I look pretty and you showed up. I want you to go talk to the CNAs and follow them around, follow the nurses around and see what they do. That's what I want to. That's what I want to see happen. That's how we're going to enact this change is by getting in and see what's actually going on. And they're not these horrible places where all we do is beat up residents. These are human beings that are taking care of other human beings for very little money. Okay, so come see what they do and tell me how you can help us change so this doesn't continue to happen. And then we're not fighting a shortage of staff problem because you're unaware of what's really going on. That's how we change this. We got to get them in the building. We got to invite them not just to my building, buildings all over the country to see what's going on.
Mhm. Because I'm sure many buildings are going through the same thing. Brittany, for you, what is the biggest limitation in your role to do your job concerning staffing?
The biggest limitation, I think the hardest thing is just you can't. I can be on the floor to help, but
Mhm.
I can't be everywhere at once.
Uh-huh.
And everybody else has, a lot of other managers. They have other things they have to do to make sure that we have enough staff for that day.
Mhm.
So there's not enough. There's just not enough staff, and you're not able to, give the care that you want to give
Mhm.
as much as you want to. At the end of the day, you could be there, like you said, from 8 in the morning till 9 p.m., and it's still not enough.
And it may even become an expectation for every day, and that's just wrong.
It's hard when you want to help, but you can't help everybody.
And you can't help every day. Has that impacted your mental health at all? Or how may that impact your mental health if it continues?
You feel, um, obviously, as a nurse manager, you feel obligated
Mhm.
because you want to help and you want to support your staff, right? But at the end of the day, when you're not able to help everybody and it sucks. It's what it's so hard because you want to support your CNAs and your nurses because there's days that it's so hard and you're not able to get the things that you've been wanting to do, call the family members, things that make you wanted to make you things that made you want to do the job.
Mhm. Because at the end of the day, what we notice in mental health is that when you don't feel productive, when you don't feel appreciated, when you don't feel accomplished, you have 10 things on your list today to do. And sometimes you leave the building after 12 hours feeling like you've not even done two of them. If it continues, you start feeling down and you start even judging yourself. Am I able to do this role? Am I able to do my job? Then anxiety kicks in. You start feeling less of yourself or less competent. And each time we are feeling less competent, there's not just increased anxiety, you may even develop depression. Not that you're not a competent person for that role, but because of all these other challenges creeping in, making you not as effective as you want to be. And I want to go to you, Miss Gloria. How can our facilities improve support systems to help staff deal with to enhance a good work environment?
Um, like Ken was saying, I believe we need to just create more awareness, um, uh, more training
Mm-hmm.
for CNAs. Oh, what else do I have here? Show appreciation, create a positive work environment. And I remember a time where, it's been years ago, where the first things in the morning we would have like a group huddle, uh, to let staff know of any shortages or anything like that, and let us know that we're going to work as a team. And that was great back then when we used to do that. I mean, that motivated us to,
Mm-hmm.
as a team, and get things done.
Right. That's very good. That's very good. I remember we used to have those huddles as well where the manager come in. Well, I have this number today. Call me for anything. I have this phone. This person is not here, but I'm here. Or go to another unit and say, your manager called in sick. Your manager will not be there, but I'm here to help. Call me. Or what times do you guys plan to do this, and get everybody involved? I'll be there at that time. What time is your trays come in? I'll help pass out trays. I'll help. So during those huddle period, like you said, is very, very necessary because it builds that teamwork and it motivates them. And they may not even call you, but just knowing that you got their back makes
Yes.
the work go, makes them, it makes the day lighter knowing that someone is there for them. Any last word, Kenny, before we round up?
No, I just think we have to continue with the awareness and make people get people involved. I mean, the more people we can get to tell their stories, and the more people we can get in to see what we really do on a daily basis, I think is going to help this industry a lot. And I hope that in my dissertation, I plan to do even more studies than just that one on staffing in nursing homes, that we can just make people more aware and understand what our staff go through on a daily basis.
Yeah. And people are watching. We are getting more than 2,000 views on these topics in YouTube. People are watching. And no, we cannot overemphasize this topic. What we had planned to do this month, anyone can do, is start by writing our states representatives, inviting them. If they cannot have time to come, we want to invite them to revise this mandating staff or to look deeply into it and try to find other solutions rather than mandating staff. If it is some grant or something that can motivate more people into healthcare, that can help as well. They can give out something to increase pay. There is so many things that at a state level and even at a federal level can do for healthcare facilities. because we are seeing a lot more healthcare staff members getting mental health, and it is coming from stress, increased stress. Brittany, what are your final words on this?
I think education, like we've talked about, Kenny made it a great point. Invite everybody in, let them see, because nothing's going to change until they actually see what's going on inside a facility. You know, mental health is so big, and people deserve to go to work and enjoy being there.
Mm-hmm.
And residents deserve the best care, and those are the first steps we have to take to do that.
Absolutely. Absolutely. Creating the awareness and making the change. Miss Gloria, what are your last words here?
Well, I just want to thank you to have me here, Kenny. Yeah,
Thank you.
yes, I agree with you too that the awareness needs to happen. Also, I would like to read that whenever you're finished with it. I mean, I'm interested in that. And I think I'm going to follow this podcast from here on. I mean, I'm learning so much,
Yeah.
and get the word out on this.
Yeah. By next one, we will actually say what we have done and see where we are. This is not a podcast. This is a movement that will continue until something happens. And I am so happy, Kenny, that you're writing on this. It will go a long way. The more people talk about it, the more people write about it, the more we call attention. Because if we are just complaining and not doing anything, then we are no different. Then we are just leaving things stagnant on the table and expect that it will take care of itself. And thank you, Osita. Thank you, Christina. Thank you, Rebecca. Just to acknowledge some few people online. Thank you, Pretty. Thank you. We'll not have time to read all your comments, but thank you. We appreciate you guys being there. And thank you all for coming today. We really, this is a topic that doesn't start and end here. This is a topic that will go further until something changes. I'm already happy that Kenny is doing a dissertation on that. That will be impactful as well. Anything that disrupts flow, anything that causes stress, anything that causes emotional distress or disruption, anything that makes you not want to do the thing that you love, anything that gives you anxiety and uncertainty, waking up the next morning, checking your phone like, oh, how many callings, or going to work and praying like, oh, I hope everybody shows up, or just dragging to work, anything of those nature will affect our mental health. What is our health without our mental health? There's a growing necessity and a growing need for mental care these days because more people are suffering. If we can prevent some, let us do so. If staffing issues are causing more people to go into mental health, let us try and prevent those. And how do we even take care of our patients when we are not able to take care of ourselves? So, this is a real issue and it needs real solutions. Thank you, everyone, for being here. And we will continue this podcast next month, and the month after, and the month after, until something happens, something gotta give. These are real problems needing real solutions. Thank you all for watching. Until next time, it's been All Mercy Podcast. Bye bye for now.